now.
Good afternoon. Buenos, what do I say? Buenos tardes.
Buenas tardes. Oh, that's fine.
Buenos tardes. How'd I do? And welcome to the City of Lawrence Ex-Smokers Hall of Fame. My name is Diane Knight, and I'm the director of the Tobacco-Free Community Partnership, a program of Greater Lawrence Family Health Center and the Northeast Center for Healthy Communities. And this program is funded by the Massachusetts Tobacco Cessation and Prevention Program.
Buenas tardes y bienvenidos a todos al Salón de la Fama de los Exfumadores de la ciudad de Lawrence. Ella es Diana Knight, la directora del Salón de la Fama de los Exfumadores y del Tobacco Free Community Partnership, la Sociedad Comunitaria Libre de Tabaco, y el programa del Greater Lawrence Family Health Center y el Northeast Center for Healthy Communities, patrocinado por el Massachusetts Tobacco Cessation and Prevention Program.
The Ex-Smokers Hall of Fame was created 18 months ago to encourage ex-smokers from across the region and the state to come forward to tell their story about why they quit, when they quit, and how their life has changed since they are non-smokers. It is their hope that by sharing their quitting experience, that they can encourage and inspire other smokers to quit or to make another quit attempt.
El Salón de la Fama de los Exfumadores fue creado hace 18 meses para animar a los exfumadores a través de esta región y del estado a unirse para compartir sus historias acerca del por qué dejaron de fumar, como esperanza al compartir de su experiencia para que otros dejen de fumar. Ellos y otros están inspirados a muchos a dejar por fumar o por lo menos intentarlo una vez más.
This spring, the Lawrence Senior Center partnered with the Tobacco-Free Community Partnership in an effort to reach as many smokers as possible who are willing to share their story. Sure enough, the Senior Center was up to the challenge as usual, and I am proud to say that today we will welcome 34 new members into the Hall of Fame, thanks to their support.
Esta primavera, el Lawrence Senior Center, junto con el Tobacco Free Partnership, en un esfuerzo por alcanzar a cuantos fumadores posible que querían compartir con su historia. Todo esto fue todo un reto para el Senior Center. Y la señora Diana Knight está muy orgullosa de darle la bienvenida a los nuevos 34 miembros del Salón de la Fama por su apoyo.
Today is our third Hall of Fame event in the city of Lawrence. Last April, we kicked off the campaign with a celebration of 14 ex-smokers from the Greater Lawrence Family Health Center. And then again last November, we welcomed 11 ex-smokers from Lawrence General Hospital at the Great American Smokeout. Today, our 34 ex-smokers join 105 ex-smokers from across the state of Massachusetts that joined the Hall of Fame in 2010.
Hoy es nuestra tercera celebración de la ciudad. El pasado abril, la campaña tomó empuje con la celebración de 14 exfumadores de la ciudad que participaron en el Greater Lawrence Family Health Center, y el pasado noviembre nosotros le dimos la bienvenida a 11 fumadores que vinieron del Lawrence General Hospital y se unieron al Gran American Smokeout. Hoy, nuestros 34 exfumadores se unen a 105 exfumadores de todo el estado que se unieron al Salón de la Fama en el 2010.
I would like to recognize two of the ex-smokers from the Greater Lawrence Family Health Center First Hall of Fame. That is Kirsten Doherty and and Helen Phillips. And they were inducted into the Hall of Fame at previous events. Thank you very much for coming to support and welcome our new ex-smokers, and for your continued support in this project. Thank you very much.
Hoy Diana quiere reconocer a cualquier exfumador que esté aquí del Community Health Center o del Lawrence General Hospital, que fueron introducidos en el pasado al Salón de la Fama de los Exfumadores. Por favor, párense, y quiero darles las gracias y démosle la bienvenida a nuestros nuevos exfumadores por su apoyo continuo.
Thank you. And we'll proceed with our program, and I would like to welcome our mayor, William Lantigua. He's going to share a few words with you today. Thank you very much for coming. Hi, thank you.
Buenas tardes. La señorita me dijo que ella no va a traducir, le vamos a dejar un problemita en la mano a ella, casi ya. Primeramente, agradecerle al centro la ayuda y la cooperación, Marta Vélez y el equipo, por el trabajo que hace, no solamente con este programa, sino con todos los otros programas. Pero la señora Diane Knight tiene mucho interés, mucho énfasis en no solamente que aquel que quiere dejar de fumar, deje de fumar, sino se envuelve en muchas otras cosas más, ofreciendo ayuda y consejería y asesoría, si así se puede decir, a todo aquello que tienen cualquier pregunta en cuanto a cómo se aleja una persona de un hábito que es tan difícil. Es de orden felicitar a los que han dejado de fumar, porque no es nada fácil, es como cualquier otro vicio, es ya una costumbre, y las costumbres son bien difíciles de erradicar. Pero yo creo que nadie deja de fumar de manera permanente si no tiene un apoyo incondicional fuertemente de su familia, de la gente que lo rodean. Y yo quiero felicitar a esos familiares que son los pilares, en verdad, que le acuerdan a la persona el por qué debe dejar de fumar, debe dejar ese vicio a un lado, que en muchos casos termina acabando con la vida de ellos, y es una falta permanente para la familia. Entonces, el crédito va de igual manera, vuelvo y repito, no solamente a los que dejan de fumar, sino al apoyo que reciben de sus familiares. Es un gran día. Yo espero que el año que viene, sé que allá afuera hay muchos fumadores, yo espero que en esta misma recesión dupliquemos el número, y estoy seguro que cada uno de ustedes conoce mínimo una persona que fuma, que quizá tiene el gran deseo de dejar ese vicio, pero por razones particulares no han podido dejarlo, porque como digo, es un vicio, es una enfermedad prácticamente, se puede decir así, y no es tan sencillo, no es tan fácil. Tú ves gente comiéndose las uñas, jalándose el pelo, hacen todas las cosas que pueden hacer para tratar de dejarlo, y la nicotina vuelve y lo trae otra vez al centro. Pero de nuevo, cuando hay una familia que apoya, que les recuerda, si tú faltas, nos faltas a nosotros también, eso es muy significativo en la persona. Ahí, de nuevo, con los programas que hay en pie, la información, que muchas veces eso es parte del problema, la falta de información, todo eso en conjunto, y vuelvo y repito por cuarta vez, el apoyo de una familia, de un amigo, eso conlleva que muchos de ustedes hayan logrado darle la patada, como dicen en inglés, a un vicio malo. Solo felicito a todos. But then you're going to have to pay me for the translation, my friend, because that was supposed to be your job. I'm just delighted to be here before all of you, and I said thank you to Marta Velez and the Center for giving all of us the opportunity of being here, and also to congratulate all of you who, through one means or another, have been able to, as they said in English, to kick the habit. Smoking is very addictive. It's one of those things that even when people try very, very hard to step away from that, the nicotine pulls you right back to the center. I also said that as well as you all should be congratulated, those of you who were able to literally step away from the nicotine. I think you will not be able to do that if it was not because of the support that you receive from the people around you, especially your family and friends. I know a lot of people who have tried very, very hard to quit smoking and drinking and doing other things, and it's difficult. It's an addiction. It becomes a disease. But without the help of, again, programs like the one that Aya Knightley is directing, without the help of mentoring, without the help of counseling, and without the support of your closest family, it becomes almost impossible. So as much credit as we would like to give you who stopped smoking for whatever amount of time there is, I think your families and friends also deserve the same amount of credit, the same gratitude. I also ask you that, or say that every one of you know of at least one person who's a smoker who would love to literally step away from the nicotine, but as I said earlier, it's very, very difficult. But if you tell that person not only about the services, but continue to mentor the person and to remind the person that what is the price to pay at the end, if they don't quit early enough, is that not only they're going to be missed when they leave, but how much is their family going to be, how big is the emptiness that's going to be created on their family when they're gone? And sometimes that get people thinking, because sometimes we are selfish and we only think of ourselves, and we forget to think about the people around us, family, friends, wife, kids, grandchildren, whatever. And when that is reminder, people start to think a little bit deeper as to how significant it is. It's not just themselves that are going to be put into the suffering, but it's also the family. But it goes back again to the family. Without the support of the families, it's even harder to quit. So again, I just want to congratulate you especially for all that you do, and the center, and the Greater Lawrence Family Health Center, and everybody involved in whatever the office of the mayor, either through the office or through myself, whatever we can do to help out, just let us know. Thank you.